am the event manager at the Health Collaborative. The Health Collaborative is a nonprofit, multi-stakeholder organization based in Cincinnati, Ohio. We are the hub for healthcare in the region. Collectively, we work together to help serve the community. We lead data-driven improvements that result in healthier people, better care, and lower cost. And our services include a robust set of improvement-oriented benefits to our memberships, including our 30 hospitals and healthcare systems, 150 long-term care facilities, and 100 select business partners. And today I have the pleasure to speak to two ladies at Beckett Springs, Barbara Thompson, our Outreach and Development Director, and Hayley Cole, Inpatient Therapist. So thank you, ladies, for joining me today. How are you?
Very well.
Good, thank you.
Thank you, Ameenah, for setting this up.
Good. Well, I'm happy to have you all today just joining me. And, I hear Beckett Springs, it's a buzzword around my office. So I'm always listening out and hearing things like, who is that? What do they do? So Beckett Springs, you offer a variety of specialized programs, including mental health and substance abuse and child and adolescent programs. So how could someone get started with the programs that you offer?
Sure. And just kind of recap exactly what that means in our programs. We do both inpatient care. So we have inpatient units, which is all adult, and that is acute care for mental health crisis or substance use disorders. And then we have outpatient programs, which are partial hospitalization, which is kind of like a day program. People come 5 to 6 days a week, 5 to 6 hours a day, depending on their program. And in those, we've got 5 different tracks, including mental health, primary substance, and then dual diagnosis. And then we have the child and adolescent. You mentioned we have a program called Help for Heroes, which is geared towards first responders and their specialized issues. And then we also have a program for older adults, the Wellness Integration for Their Experience. So those are all of our outpatient programs. And to get involved, people can call themselves. They may be referred by a physician or an outpatient therapist that they're seeing. A lot of people come to us from the hospital. Ideally, we want to catch people before they end up in the ED, whether for suicidal thoughts or an attempt or substance use takes them there. We really want to get people before they get to that level of care. So they can just call and ask questions. And all of our assessments are 24/7. We're here and they're free. And right now we can do assessments over the phone or through the Zoom platform.
Okay, great. So there's obviously lots of changes folks are dealing with the whole COVID-19 pandemic. Folks are trying to balance work, life, school, kids are home doing online learning, dogs barking, husband, you name it, they're like, trying to figure this out and trying to adjust. And, many people are, experiencing a lot of emotions, during this pandemic and during this time and, just trying to keep all the balls in the air. What are some coping mechanisms that people can try to adapt to what we're now calling this new normal?
Yeah, it certainly is an adjustment for a lot of people. Day-to-day life looks a lot different. Some people.
I can barely hear you, Hayley.
Oh, can you hear me now?
Come a little closer.
So it certainly is a new normal. A lot of people are learning that they have to adjust. And I think anxiety is so heightened because it feels like we have no end in sight. We listen to the news every single day. We get, these new CDC recommendations where we get stay-at-home orders, or those orders start to look different. And so people want to know, okay, when is life going to go back to normal? Which of course makes the day-to-day right now pretty hectic.
Right.
Some coping skills that are really helpful in all of this are to find some sort of time in the day to practice any sort of meditation or deep breathing, something to keep you centered and practice your mindfulness. It can be really difficult when we're having a lot of anxious thoughts to stay in the moment and we start to spiral. And so it's important to think, okay, here I am, I'm working from home, or I'm here with my family. We're here, we're safe, but also recognizing the fact that this is a stressor right now. And I think something that's been really cool and a benefit of people being connected through social media is there's a lot of really good stories happening out there right now. And I think a big reason people are feeling so overwhelmed is the news is constantly, it's changing, and we want to be updated, but maybe taking a step back and reading or viewing some of those more positive stories. There's a quote from Mr. Rogers that I love, and it always says, look for the helpers. And I think that gives people a lot of hope, looking for people who are looking out for their elderly neighbors, giving them meals, people who are taking the time to do, masks for healthcare workers, things that make you feel a little bit better about the situation, not just the impending doom that we tend to hear on the news a lot. So being able to remove yourself and focus a little bit more on the good that's happening. And I'm a big advocate of practicing gratitude. I think that it's something that can help us get through really tough times while still acknowledging that we have these emotions, but being able to say, I may not have my normal day-to-day routine, but here are the things I do have right now. I have my health, or I have, my family at home safe. I have the ability to work from home, whatever the situation is. And then if it does get to be too much, reaching out for help is really important, and knowing that you aren't alone. We're all feeling stressors, but those stressors are going to look different for each person. So reaching out is definitely important.
Yeah. I have been really getting up and dancing. A lot of DJs have been doing live streams online on social media. And so one of my favorite DJs has kind of taken it by storm. And usually every day, almost every other day, he does a live set. And it's like that feel-good music, that old school music that we grew up and listened to and loved. And, for me, that is like my escape. And I've been enjoying that, and I look forward to it, and, I check his page to see, if he's put a flyer up to see what time he's going to go on and go live. So, so I can, take that time and, I just start dancing, and that's my kind of like release. And for, like you said, others can do things that can make them feel good, making masks or meditating. So yeah, those are all great things. So for me, it's music is my therapy. Yeah. So Beckett Springs, you have a facility in Westchester, Ohio, correct, and Dayton, Ohio, correct? And right now, are folks able to still come to your facilities, or do they have to do virtual sessions when they're after they give you a call and do an assessment? Do they have to physically come to one of the two locations, or are telehealth services available for them?
That's a great question. They can do either right now. For inpatient, they are here at the hospital, stay here for 7 to 10 days, but all of our outpatient programs are all telehealth. So they're Zoom group meetings like this, because it's a lot of group therapy that we do. But to do the assessment, which the assessment determines the level of care somebody needs, whether it's inpatient care or our level of outpatient, which is still a pretty intense level, or traditional one-on-one therapy, which we would refer out. But they can do that assessment over the phone or through the Zoom platform. And that is a newer thing for us to be able to offer to people, especially the phone assessments. And then when we determine they may need an inpatient stay, we set up a time for them to come, get their belongings together and come in, and then start their treatment. And then most of our inpatient people step down to an outpatient program. And so we get them set up, making sure they have the Zoom app, making sure they understand, what's expected, because it is different too, running groups when everyone's at home versus everyone's present and in the room.
Has it been effective, do you think, that, doing the...
I think I've gotten some feedback from patients that have stepped down from inpatient, which is when I work with them, and have reached out to me, just to have some of them follow up, say, hey, I'm doing well. And I'll ask that question. I'll say, how is it? Because it's certainly different than the normal. And they like it because it helps them with that structure throughout the day,
Okay.
which I think all of us are probably dealing with lack of structure right now, no matter what our situation is. And so having something that they can, log in at a certain time, participate for however long, it gives them something that they know, this is what I'm going to do today. It helps keep them on a right path in their mind.
And we did have a patient reach out directly to us, sent a note to our outpatient director, and basically said he didn't see any point in this and that it was kind of dumb and it wouldn't work. And he would log in and give it a try and then just go on his own. And he was very pleasantly surprised that it was effective and he felt connected to the group. He was worried he wouldn't feel connected. And like to Hayley's point, it gave him a schedule for the day and topics to, and then things to do outside of that as well, because it's not, the nice thing that I've always said about our PHP program, the partial hospitalization, is the patient comes here, they're here all day. In this case, they're at home on Zoom, but then they can use those same tools when they're back at home, and those same triggers and stressors show up in their life. Whereas when they're inpatient, they're kind of cocooned and safe from the outside world. But so that was exciting, that because we do wonder too. How's this
Right. Very good. So for those individuals who have been laid off and, maybe furloughed right now and, experiencing some, financial implications, are there options for insurance or self-pay, or is financial assistance available to those who need it? How does that look for someone signing up and utilizing your services for the first time?
Sure. And finance is certainly a major stressor in people's lives for all of us, regardless. So we like to not add stress to our patients when possible. So we do look at that. So if they have COBRA insurance, or they may still have their insurance if they're being furloughed, they haven't been completely laid off, we'll look at those options, and we'll have a complete discussion with every patient before they admit, based on if they have an out-of-pocket, what that is and how we can manage that. And so looking at all of those pieces, our goal is to break down all barriers. I mean, our hands are tied by insurance on some things, but if we can get someone into treatment, we're going to do everything we can to make that happen. And
I've actually seen quite a few people recently who were furloughed.
What's that, Hayley? I couldn't hear you.
Sorry, I've actually seen quite a few people recently who were furloughed and then were able to utilize this time that they might not have had before to work on themselves and to really, take the time that they need to get better. A lot of times people come in here and a huge stressor is getting back to work, getting back to taking care of your bills and all those daily things that we have to take care of. So, that's one of those, talking about practicing gratitude, is this really stinks being furloughed and this is taking a lot, but maybe this is the time that I can work on myself and get well so that I can continue doing what I need to do.
Yeah. I just said that yesterday to someone, that I think a lot of folks are making their health more top of mind and more of a priority right now. This whole wash your hands and, practice good hygiene and that sort of thing. I just feel that it's now top of mind that, they're taking it more seriously, especially, their family members and not wanting to get anyone sick in their home, or, going out to grocery stores to, be mindful of, maybe what they're touching. So, hopefully, this will kind of change some dynamics with some folks, as you said, to kind of just focus on them some more. And, we're all so busy and we're pulled in so many different directions from day to day, and, some downtime for some folks that didn't have that before, maybe what the body needed, what the mind needed, and being able to kind of hit that reset button. So, yeah. Well, ladies, I have one more question for you. I don't want to take up too much of your time. I appreciate you joining me today. Tell me, how has partnering with the Health Collaborative helped spread Beckett Springs' mission and the services that you offer?
Sure. I love working with the Health Collaborative. As you know, I've used the education rooms multiple times and hope to again when we can see people in person for our education programs. I manage a lot of our community education programs and continuing ed credits. And so using the Health Collaborative to both promote those events when we have them and then hosting them at the location. It's a great location, centrally located, and the facilities are certainly the best. But then also having our information as a resource on the Health Collaborative's website. And then I know other members, our CEO has participated in some of the roundtable discussions that Health Collaborative has done. So it's just really helped us increase how we work with the community, the healthcare community specifically, but getting our information out to other healthcare providers. So I think it's a great partnership.
Good.
That great annual meeting thing every year.
What's that?
You throw that great annual meeting thing every year. That was a fun dinner.
Oh, the Inspire dinner.
Yes.
Yeah. Yes, the Inspire. Yeah, that's my baby. Yeah. So we appreciate you supporting that as well, and definitely appreciate the partnership. And, I look forward to having you come back to our Learning Center to be able to continue those workshops when we're able to go back into our building and, make sure everything is safe and sanitized. So definitely we look forward to working with you again and again, and love the opportunity to collaborate with Beckett Springs. So again, thank you so much, Barbara and Hayley. It's been a pleasure talking to you, and I hope you all stay safe and well and healthy.
Oh, thank you, Ameenah.
Have a great day.